Hello guys, welcome to Dr. Science. So today we are going to talk about the stages of labor, and not only that, we will talk about the active management of third stage of labor. Okay, so first please draw this diagram with me. So here is the vagina, this is the cervix, this is the uterus, and inside we have the baby. This baby is going to have umbilical cord, and here is our placenta, which is supplying the nutrition to the baby via umbilical cord. Okay, so the stages of labor is divided into 4 stages: 1, 2, 3, and the 4. So first stage of labor is nothing but from the onset of pain. The patient will complain, I am having pain, up to full cervical dilatation, that is up to 10 centimeters. Now what is this cervical dilatation? As you can see here, the cervix is very narrow here. So this narrow cervix have to dilate in order to compensate the baby's head, right? So it will dilate up to 10 centimeters, which is called as your full cervical dilatation. Okay, that is the first stage of labor. Now the second stage of labor is nothing but full cervical dilatation to the delivery of baby. So once the cervix is dilated, the baby will come out. Okay, the baby is delivered. This is the second stage of labor. Now during the third stage of labor, this third stage of labor is very important. It is the delivery of placenta. Now what is meant by this? We will just draw the diagram here once again. So this is the vagina, this is the cervix, and this is the uterus. Now here is the placenta, and here is the umbilical cord, and I already told you the baby is delivered. Okay, now this placenta is getting retained in the uterus, so we have to remove this placenta. So we have to deliver this placenta outside. So this is nothing but third stage of labor. Okay, and we want to remove this placenta as soon as possible, or else there will be bleeding. Okay, so third stage of labor is nothing but delivery of the placenta from the uterus to the outside. And finally, the fourth stage of labor is nothing but postpartum, or observation up to 1 hour after delivering the baby, or we simply call it as postpartum. Okay, now what is this active management of third stage of labor? I already told you that during the third stage of labor, we are going to deliver the placenta from the uterus to the outside. Now what we will do, we will see. First we have to give oxytocin 10 units in intramuscular. Okay, now why we are doing this, we will try to understand it here. So this is the vagina, this is the cervix, and this is the uterus. So the placenta is here. So when you give oxytocin to this patient, oxytocin 10 units IM. When you give this oxytocin to this patient, the uterus will contract vigorously. Okay, now this contraction will push the placenta outside. That's why we are going to give this oxytocin 10 units. Oxytocin will cause contraction of the uterus. And not only that, after the first thing is we give oxytocin, Now the second thing is we do a cord traction. Now what is this cord traction? We usually take the artery forceps, or the forceps, we take the forceps. So this is the placenta and this is the umbilical cord. So we usually take the artery forceps and we will rotate this. Okay, we will rotate this umbilical cord and the placenta, so it will come out it will come out of the uterus. That is called as your cord traction. And finally we will do the uterus massage. Okay, so first thing in the in active management of third stage of labor is we give oxytocin 10 units IM. Next we do cord traction, that is through artery forces, and we will rotate it. We will rotate the umbilical cord so the placenta will come along with it. Finally we will massage the uterus. Okay, so that was about it. Thank you guys.